at 6 o'clock. Hi, everybody.
Hello.
Happy almost Thanksgiving. Nice to see everyone. We once again have a Bills game on the night of our Board of Health meeting, so we, I'm sure, have an expedited agenda. Okay, so we'll get right to it. I understand there is no privilege of the floor tonight, no? No guests? Okay, we will move right on to the approval of the minutes from September 18th. These were sent out ahead of time. Were there any questions, edits, or comments?
Move to approve.
We have, okay, we have a move to approve in a second. Any, all in favor?
Aye.
Any opposed? Okay. All right, moving right along to new business agreements to settle.
So you have a couple pages of agreements to settle in front of you. Again, these are water system violations. Broken down per usual with, individuals who had, one violation in this latest round. And then there is the one facility that had a couple of violations. So these were all the agreements to settle that they chose not to come to the Board of Health hearing, and paid the fine as was indicated in the agreement to settle.
Just a question about one, and I've seen other public ones, and
Sure.
I think Fredoni was one of them, but I see Brockton, Portland Water District. I don't know, it's a little bit surprising to me for, and again, I'm not fussing about them because I've seen others too.
I mean, I don't know all of the specifics about this particular violation. I believe that they may still be working through a little bit of they are still part of the North Chautauqua County Water District. However, there's been sort of a reorganization of how municipalities are responsible for their own systems. And so this may have been one of those situations where they're still figuring out, what they're responsible for and who their contracted people are to get those samples done.
Okay, yeah, it's there and it's paid. I
Yeah.
don't know, I don't know, disappointing, whatever, when I say real public entity like that.
Yeah.
Okay. Thank you.
So, yeah, so that's what I have for agreements. So I don't have any, cases, for you to decide anything on this meeting. I anticipate that I may have a couple, if not a few, next meeting.
If there aren't any other questions on the agreements to settle, we'll move on to old business. We have the tobacco license revocation up first with Clouds of Lakewood.
So this was, cases that you've heard about previously. The Clouds business, in Lakewood had a suspended license, and while their license was suspended, we did find them in, continuing their operations. So, we had brought them in for the Board of Health hearing, and moved forward with the fine and the recommendation to New York State Department of Tax and Finance to revoke their license. We got notification their license was revoked as of September 18th of this year. There was a little bit of a delay in us receiving the information. We didn't hear about it until the middle of October. I think, just staffing and things at the state have been, there's been some extra things going on. So we didn't get notice of this. That's why you didn't hear about it at the previous meeting. So now that the license has been revoked, our next steps are, between 2 and 3 months after the license has been revoked, we are tasked to go back to the property to make sure that they are complying with the revocation. And so we have not yet done that. We're just entering that 2 to 3 month window. So we haven't been back there yet to see if they're still operating.
So they're not to be operating at all?
No, well, they
They can't sell.
could
tobacco.
still, they could sell things like glassware, or other like, decorative sort of, things, but they can't be selling cigarette or tobacco products or vapor products. The license was revoked for both of those. They're not a facility that would have like a lottery license or anything like that, so that didn't come up.
They were open the other day.
Yeah, they're open. They're open.
Yeah.
Yeah. And I know they've sold other products out of there too.
Well, and that's,
Yeah.
so we're given the window of
Yeah.
the revocation has to be in place for at least 2
Yeah.
months, and then we go on
And check.
to
Yeah.
do the inspection, yeah. So we're just coming into that window.
Some people have bought cannabis.
That is not something I have any control over.
I know.
Yeah.
That's not our, yeah.
Yeah. But there definitely is a state agency who would be interested in
Yep.
that information.
Yeah.
Yeah.
Yeah. In fact, one of their other locations, I think it's already been reported.
Yeah.
And just remind us, is the state working on the loophole whereby they can change the name, doing business as, and reopen under?
We have brought it to their attention. How much people are actively working on it, I can't really say.
Yeah, there's a lot that like the State Association of County Health Officials is working on around all of this in the vapor and tobacco product area. And trying to do more in terms of inclusive language, in terms of there are so many new and ever-changing products all the
Yeah.
time that they're trying to really get ahead of that. Kratom, of course, is one that's now really in the mix as well. So, just as soon as, of course, you draft policy around vaping, then Kratom's the next. So there is a lot of discussion right now, and there's a lot of support amongst the counties in the state. So now it's just how the state will be able to translate that into some real law, regulation, and rules.
I know the bills that were out there this last session didn't proceed out of committee, but there were some significant changes being proposed, and I'm sure they'll be proposed again with probably additional language as well. The last 4 years, they've been trying to modify it, and so far it's been a roadblock, but the election's over, so
Yeah.
maybe,
No more roadblock.
yeah, yeah.
So I wasn't looking for any action on this. I just wanted to give you guys an update on, the follow-up from that Board of Health order. You want me to move on?
Let's keep
Okay.
going.
So lead rental registry, and I have brought Anna with me this evening. So, the lead rental registry, there has been some progress. There is a software platform that is available to the public, to landlords to start registering their properties. It just went live the 17th. So, we're, doing our best to share that information with the public and to, start answering questions that we still have ourselves. But we're, things are starting to move on it. The actual full regulations for the lead rental registry still need to go through the public comment period. If you'll remember, they had gone to public comment months ago. There were enough significant suggestions and updates that they're going to have to go back for a second public comment period. So we're hoping by the end of next month, they'll be out for public comment for the second round. And then, we'll see what happens from there. Like I said, I mean, it is good that they took a lot of suggestions and made some decent changes, and, we haven't seen everything yet, but, what we're being told is that they really were taking a lot of our considerations, into account and, concerns. So we're optimistic, that the new regulations will help us implement the program successfully. We are fully staffed. We have all of our public health techs and community services worker and clerical operations assistant folks all in place. And the last group of them are just starting going through training and things today, actually. So we're ready as soon as we get some of the regulations to give us stronger guidance. And so that's partly what is, I can answer questions as they come up, but that's partly what brings me to the next point is we had talked to the group about the plan that we have for implementing the lead rental registry includes our staff doing the inspections to issue the lead safe certificates for these different rental properties. So I had, 3 meetings ago, we had brought some figures to you about what we were thinking that we wanted to charge for the inspections. And if you look in your packet, I included the fees in a larger fee schedule.
We're looking at, is it appendix?
So it will be, my proposal is to make changes to the sanitary code about fees in general. And then in that sanitary code amendment to create this appendix 1 or appendix A.
Just the one would be fine.
1 or
It's
A
just
is
we're gonna
whatever it
copy
needs to be.
whatever
Yeah.
is in the sanitary code, yeah.
And create an appendix in the sanitary code with all of our fees. So you'll have the permitted facility fees, the water and wastewater fees, the professional engineering fees, and then on that final page, that would be your lead program inspection fees. So what we are proposing is, upon reflection about, what this program needs to look like, the number of properties that we need to really make sure we're getting into to comply with lead rental registry requirements. Also the idea that, this program is designed to be a program that every 3 years we're going to be in these properties doing inspection. If not us, then, potentially a third party agency that develops in the community. So our thought is to essentially be nicer for the first 3 years of this program, to give us a chance to get into these properties, to identify the things that may need significant financial investment to improve them or upgrade them. So this is the proposal that we have rolled around in the noggin for quite a while, but finally sort of landed on. So the idea would be we'd go into these properties for an initial assessment, and that would just include a visual inspection and the dust wipe collection. And we would charge the facilities $100 for the primary unit and then $50 for a secondary unit, or, if it's a 4-unit apartment, it would be $50 for each additional unit. And that would be just a simple visual inspection and dust wipe collection. If those dust wipes come back showing that there is a lead problem in the unit, then we would require an additional inspection, a more intense inspection, where we actually take the XRF device in and really do a full workup of everything. The idea being that, as we've discussed previously, just because lead is somewhere in the unit doesn't necessarily mean it's a hazard. If the lead is behind a layer of paint where it's sealed and it's not being scuffed off, if, the people are maintaining the property, if things are being cleaned, if the windows aren't, sloughing lead dust off, we could be finding properties that we would deem lead safe without them being completely absent of lead. So that would be the idea. And Anna, jump in if I'm saying anything faulty here.
You're doing good. You're doing good.
So that would be the idea, is that we'll try to keep it as simple and cost effective for people as possible, especially in these first 3 years where we're really getting rolling on things. And then after that 3-year period, we take another look at fees. We take a look at, what this program really looks like. We take a look at if there have been some third-party businesses that have popped up that can handle these inspections now. Maybe there's not so many that are gonna fall in our lap. And that would be the idea, is that we give folks as much opportunity as possible, to get ahead of the game here. And then, after 3 years, we kind of see where we are and we take another look at what inspections need to look like or what fees need to look like. So that would be the idea with the rental registry.
How does this residential lead inspection differ?
So this is just us getting a phone call from a random person who suddenly heard about lead and would like a lead inspection of their home, but can't find a third party to come out and do it. We don't have very many, if any, third parties who work in the county regularly to do lead inspections. And we get phone calls occasionally about them. And they don't necessarily fit into any of our programs because they're not rental properties, they're not in the right zip code, they don't have children in them.
A lot of that ends up coming from people calling, they're purchasing a home and they want to have a lead inspection done. Well, I mean, really, at this point, we're at the mercy of either telling them to purchase the home and wait and we can do it after, because we don't really want to get in the middle of a home sale situation. But with us being able to do an inspection for a fee, it's not covered under any program. We can just go in, do a inspection similar to what a third party would offer with really no kind of strings attached. We're just doing an inspection that they have paid for, so they know where lead-based paint and lead-based paint hazards are when they're potentially purchasing a home. So that comes up a lot, and at this point, we don't really have the ability to
We don't have
that.
we don't have a box to put them in.
Yeah.
Yeah.
So, and I mean, we might not get any, but I know probably about 5, 6, 10 times a year, we get phone calls of, hey, we're buying this property. We really want a lead inspection done. And we're like, okay, well, you gotta, call somebody from Buffalo or in the, surrounding area, because there's really nobody here to fill that gap to do a inspection.
Covers the cost. The $650 covers the
Yeah.
cost to do.
Yes.
Yeah.
And it's comparable with, what we do know other private companies and private,
I think it's a nice service to offer. I mean, somebody might want to be buying an older home, whatever.
And I thought Jessica and Anna did a nice job thoughtfully planning that price point too, because, they had shared with me that they didn't want to undercut what a private business might be able to do service for. So we didn't want to come in as, a government agency and take business away from, a potential lead inspector in the community. So it seemed like a reasonably planned price point.
and by making it appendix, we can change it easily in the future should we need to.
Yeah.
In the plan, like Jessica stated, the plan with rental registry with the visual and dust wipes, that's kind of the baseline across the whole state. That's what's in their regulations, is the minimal inspection that's required to have their lead safe certificate. So, just upon kind of ruminating every certain possible thing is, before we were like, well, if we've never been in there, then there could be lead-based paint hazards. Well, there could just as equally not be a lead-based paint hazards, and that's why we haven't been in there. So we're kind of like anticipating for every bad house we go in and find lead hazards. We probably have another house that is fine. We can just go in, do visuals, dust wipes, everything comes back clean. It's been well kept. and we can keep trucking down the road. And it frees up a lot more time for staff to do the workload that we really need them to do to meet our goals.
Just out of curiosity, what happens if third parties do perform these inspections? Are they then responsible to follow through on the remediation requirements? And do they all follow the same New York State DOH levels?
So, yeah, so if a third party comes in and does an inspection and finds problems, you know, they're required to let the property owner know. The property owner is, you know, has to fix them before the lead safe certificate is issued. We are also obligated to audit third party inspectors. So, you know, even if we're not doing an inspection, if we, you know, say a house that we were in 2 years ago is, you know, completed by a third party inspector or something, and we remember like, oh, there were a couple of problems that, you know, were under control, but maybe needed some attention, you know, we can certainly go and follow up and, you know, audit these different facilities.
And they
or
will,
these
the
different
landlords
inspectors.
will be required to submit that paperwork to us.
Mhm.
So we will need copies of all the inspections, all of the clearances, and like Jessica said, we'll be required to audit a certain percentage of those, which will be, you know, our inspectors going out, doing our visuals. Maybe we don't have to collect samples, but at least ensuring visually that this house matches what's going on in the report.
Where a third party inspection may also come into play, like during a residential inspection. That maybe has not come up on the radar, isn't a part of the rental registry. The third party were to go in and test, and it's disclosed then to the homeowner. Technically, upon transfer of that property, if they were ever to sell, they have to now disclose that they've been aware of that, which is, you know, historically, that doesn't happen very often, so.
And yeah, and so with those residential lead inspections, like Anna said, this would just be us providing information. We wouldn't be following through on full, like, work is required. It's just a simple assessment of the property. We'll certainly, you know, share good guidance and recommendations and, you know, information and let's say practices and all of that, you know, good stuff. But we wouldn't be involved with following up on anything for those residential inspections. We don't. And that's like, to Anna's point, we're meant to be sort of a backup in that situation. We don't want to be the first choice for those folks. We love there to be more private, you know, third party inspectors that can do this work.
Yeah, I just met one of them at the food cupboard in Frewsburg last Tuesday. He came and introduced himself to me and said he was newly certified for lead inspection. I think he's with St. Filippo or.
Our San
she's
Francisco
one-
guys,
yeah,
yes.
yeah.
Yeah, so.
Yeah, he was so proud of himself.
Yeah, they should be. They're such a great group of guys. They've been doing healthy homes work and work for NYSERDA forever. But they've finally jumped on board. They've gotten their whole crew RRP certified, so that's renovation, repair, and painting. They have 3 or 4 guys of lead abatement supervisor certified, and then the rest of their crew is lead abatement workers. So they're getting on board with bidding on our grant programs, and we're really, really excited to have them on board. They've really been a great addition to, you know, the whole cause here in our community.
Yeah, he recognized me from the lead conference.
Yes,
I was going in to check on funding there, and so he's volunteering every Tuesday at the food pantry in Frewsburg.
Excellent. Yeah, they're a wonderful group of guys. And girls.
Yeah.
All right, so then.
Do we need to do anything about your appendix?
Yes.
Okay.
So this would be, so the next page that has the green writing on it. So at the very top of the page, the all black writing, this is what is currently in the sanitary code. my proposal is to scroll down there and add all of this green writing. So it would be amending the sanitary code to even cite the fact that this appendix now exists with the fees in it. But then also to improve upon the language that is in the sanitary code regarding nonprofit facilities and corporations. Currently, the nonprofit facilities who apply for permitted facility permits. So things like restaurants or, you know, I'm trying to think other than food service, what do we have that's a nonprofit? It's mostly food stuff.
Got you.
No, not yet. But it's things like, you know, mobile food vendors or temporary food, or even some established food service like schools. We don't charge schools for inspections. We also don't charge anything that's, you know, a fully regulated 501c3. We don't charge them for their permitted, their permit for their facility. However, in reading this, what I imagine was intended in the sanitary code was exactly that the permitted facility fees would not apply to the nonprofits. But the way it's worded, it could leave open the idea of not charging for on-site wastewater treatment systems, for engineering review plans, and all of these other things. So I wanted to tighten that up a little bit and bring it back to being the permitted facility fees that were exempt for the nonprofits. The only time we currently, for a facility, the only time we currently charge the nonprofit, and some of you may have been here when we talked about this previously, when there's temporary food service, so, you know, the hot dog cart at the weekend, whatever, as long as we get their application more than 7 days out of the event, I am happy not charging those nonprofits. But when we receive those applications within 7 days of the event, it creates a lot more work for us. It's a lot more last minute pulling things together, making sure I have an inspector, making sure we talk to somebody about what the food safety, you know, concerns are. So the only time that we're currently charging those nonprofits for the permitted facility fees would be the temporary food permits when the application is submitted within 7 days of the event. And that's what that sort of that extra green language in there is, you know, at the discretion of the public health director, provided application and documentation are submitted or are provided in a timely manner. Just gets to that point that if you're going to expect us to be at your beck and call 2 days before an event, talk to you about food safety and make sure I get an inspector out there, I need a little skin in that game. And
I
then
think
the other,
when you put may be waived, I think is great too,
Yes.
because that's like,
Yeah.
gives a little room if something's a little sticky or puts a burden on you. It may be waived, but it doesn't always guarantee it.
right, yeah. People are constantly coming up with new and creative ways to challenge our current workflows. So yeah, so that was my idea about that bullet A. And then bullet B was to talk about reimbursements. We've essentially always had policies that we've operated by, but it's never actually been in writing anyplace. So my point was to actually get it in writing someplace. Most of the time we don't have issues because the permitted facility fees are never reimbursed. The on-site wastewater treatment system application fees aren't reimbursed. Where we get into an issue with fee reimbursement is frequently the property transfer inspections. Unfortunately, not all of the lawyers and realtors and people selling their properties communicate very well. And sometimes they submit applications for me to come out and inspect a septic system and a well when the property is downtown Jamestown. So we do our best to find those things before we charge, before we process all of the fees and weed that out. but occasionally something slips through. And so the point is that I would like to reapply those fees whenever possible to something else. So if they had submitted an application for a property transfer and maybe it did have a septic system, but the septic system, we're not even going to bother inspecting it because it just needs to be replaced. Rather than reimbursing that, we would simply apply that fee to the cost of a septic system permit fee. Or if, I guess that's the only one that I can think of off the top of my head. I can't think of any other, or if maybe if the person had, multiple properties that they were selling, and rather than reimbursing and taking up the staff time and the fiscal time of doing reimbursements, we would find ways to, redirect that fee that had already been paid and processed. Going along with that, not reimbursing the credit card transaction fees, because we already are underwater on our credit card transaction fees. We're currently charged 2.5% for credit card transaction fees. Fiscal told me that in the past sort of 6 months, we've been paying out roughly 2.62%. And so we're underwater. And then if I start reimbursing all of those fees, it just like we're still doing all of the work. So just a couple of things, trying to clean up the sanitary code slowly to make some progress, and leave things better than where we found them.
How about your question at the bottom of the page?
Yeah. So,
I think, I think, and maybe there's a difference between big ones. Wolf and I were talking about hospitals, as an example. I don't know. SUNY Fredonia or JCC. It's a wide range of not-for-profits. Obviously, some of I don't have any employees. I don't know. They might not have a forward-facing site in something like that either. But I don't know. And I don't, bigger than this, smaller than that, get nuts about it.
And
that's the problem.
Typically, that designation that you're talking about, would be like community-based organization, nonprofit.
Yeah.
Which is sort of to your point of, you can have some pretty large nonprofit organizations that
Chautauqua.
have some money flowing through
Right,
them.
there you go. Yeah,
But it is interesting, and this, Jessica had, has done a great job, bringing these things to me, and as we've talked through things too, and putting things, on my radar. But this was a discussion, this came up at Jamestown City Council maybe about a year ago too, where there was some discussion around food trucks, and there was a local church, that had been operating, and there, so this does come up. They had actually cited us sort of incorrectly in that article. Clearly, I don't forget things. So that, they had said like, oh, the county charges, for, and it's like, well, no, we charge for like some hookup thing, like water treatments and things like that, but not for the permitting. So this, you don't think these things come up, and they do.
but there is a lot of nuance.
Yeah.
And
And that's the
because
problem.
then
You could wordsmith it to death, and then
Yeah.
there's still gonna be a new situation.
well, and then there's these sort of one-off events, like
Yeah.
the local Boy Scout troop wants to have a fundraiser because they just found out one of their troop members has cancer. I don't,
Yeah, so they have Chevette's barbecue come in or somebody,
Yeah.
right, and then all.
so,
Yes, we don't wanna,
Oh.
Yeah.
tack on a big fee for
Right.
those type of.
yeah.
Well, I don't know if there's a word, like you said, a community organization, but I don't know what, the hospitals have a word, community organization.
Yeah.
So I don't know, just,
But I wouldn't consider them a CBO.
Yeah, community-based, UPMC is not probably, wouldn't fall under the community-based. Typically has to be like a local.
Yeah.
Foundation,
Yeah.
I guess by my comment, maybe my bias would be that for a large nonprofit should be charged. And that's
Yeah.
kind of what I'm thinking, but it's, what's large, how do you write it? I don't
Right.
know. I don't wanna, I'm not gonna wordsmith. I just,
Well, that,
think
you could
maybe it could be.
consider one of those two, that could also be at the discretion of.
Yeah.
We could do
Yeah,
it that way.
then you better be consistent. Well, you didn't. do it.
It's true, that's true,
Isn't
because
it?
it typically is the public health director who's signing off on it,
Yeah.
so I do
Right.
appreciate.
Yeah, I mean, it's, well, I heard about this, that, whatever.
Right,
I
yeah,
don't know.
that's true.
And they have to, know about it.
Yeah.
Too, so it's, well, maybe it's not worth it. I don't know. I just, when you get corporations that are, 50, 100 million plus, I mean, they probably should be held to the same standard of other stuff. And again, I think the colleges, whatever. I mean, there's enough historical institutions, true,
That's why I don't have any suggestions about how to differentiate.
Okay.
Because I was thinking, but I couldn't come up with anything that really,
You could base it on number of employees would be
Yeah.
one way. That's pretty black and white, assuming they're
Yeah.
forthcoming with that information.
I also
Where
want,
that threshold would be, I'm not sure.
well, and I mean, selfishly, I also don't want my staff to become,
Yeah.
to be
Oh,
looking
monitor.
at buckets
Yeah.
of
Right.
documentation before we can issue a permit.
How big an issue is it? I mean, that's the other,
And that's, I don't think, I mean, we just went through budget season. I don't feel like we're suffering for the way that we have been doing things with our nonprofits. I mean, in some of these things, like, you mentioned, like SUNY Fredonia, they actually do get charged for their food service because it's run through a private contractor.
Right.
So. Yeah.
It's also something that we could look at for our planning division too, as we move forward over the next 3 years, we could sort of, start pulling more specifically like those, how many of those permits and what we're doing and see if there is maybe a clean sort of way that we could make a break, whether, based on employee, some sort of easily accessible information or something like that we could sort of work on, over the coming years and. look at
yeah,
that.
that'd be okay.
Because-
Just my view, if they're big enough, I don't think it would be unreasonable. That's all, because
Yeah.
you wrote a question,
Yeah. Yeah.
throw out one person's perspective.
I mean, even on the application, they check their nonprofit or whatever, you could simply have a question, do you have more than employees? And they can lie, but
Right.
but probably they're not going to. If they're a big corporation, because it's easily checked.
And most of the things we have are not the big corporate. I mean,
Yeah.
most of the stuff we have, I'm talking about, churches having barbecues
Right.
and going out to festivals and things. I mean, we don't have a lot of big nonprofits.
Yeah, so if there's
So-
10 of them, it may not be worth dealing with.
Yeah.
I don't know.
And if they self-report that they're big enough, they pay the fee.
Yeah, and on the other hand, I will say, we were just having a discussion about, sort of a parallel subject, that in many cases, we would just love that they are reaching out.
Yeah.
Yeah.
It would just
In
be
the
happy
first
to
place.
tell
Yeah.
you that they're making phone calls.
Yeah.
Yeah, so that is, I guess, something else, to consider as part of that conversation is that, a number of them aren't, reaching out. And so anything we could do maybe to, break down any of those barriers and make them, much more open to reaching out to us.
Yeah. So,
You need us to make a motion?
so
So
yeah,
all
it
these
would-
other fees, is it been-
Yeah, so, and I can go through, a lot of these haven't changed, so that whole first page, nothing has changed from where it is currently. I'm just making it part of the appendix and trying to organize it a bit cleaner.
I
I
have
have
a point of
a
information.
Sure.
Go ahead.
Well, I was just wondering how you determine what's high risk, medium risk, low risk, and.
Sure, it has to do with the type of food that's being made and the type of process they use it. So something like a movie theater that does fountain soda and popcorn, those are low risk. They get inspected once every other year. Obviously,
So
we
there's
get
some
it.
sort of definition for them. is
Yes,
what you're
yeah,
saying.
yes,
So they're
yes.
defined, okay, you know
Mhm.
what they are, and I
Mhm.
don't need to know.
Okay, yeah.
As long as it's
Don't tell us about the high
defined
risk. Yeah, high risk is like like somebody makes a giant pot of pulled pork
Yeah,
or a
round.
giant pot of soup on Monday and then they cool it and reheat it. That's high risk because you're taking it through the temperature curve.
Potato set.
Yeah,
Yeah.
I mean, I agree, as long as it's defined
Yeah, it
somewhere,
is.
so
Yeah.
somebody can't say, well, how come? You know,
Yeah, the risk is specific to foodborne illness risk. basically.
Mhm.
okay.
Okay. that's
Yeah.
fair.
Yeah, the type of food and how they're preparing it, yeah. So, yeah, so that's the first page, all of those are pretty much the same, or they are the same. The second page, everything is the same on here.
I had one question about it,
Sure.
is why are we still even offering the Clean Indoor Air Act waivers? Because when that bill was passed, that was supposed to be a temporary thing to transition the businesses. And was that a legislative decision, or I don't know? And I know we still have a couple in the
Yeah,
county,
we do have a
and
few.
that was never intended to be more than 2 or 3 years. And it's been 22.
I
Bit
can
much.
look
Yeah.
into that. I mean, I didn't know there was supposed to be a timeline
Well,
of those waivers.
The waivers were given, they were made part of the legislation as a courtesy to transition the businesses over to a smoke-free environment. And our local rural counties tended to use that as kind of a way to placate a few loud people. So like, luckily, a couple of them went out of business, and like Brenda Perks and things like that with Mel's place. But I know the one in Jamestown still has their sign up, proudly smoking facility, enter at your own risk. And that was just never supposed to, I mean, I was part of that legislation 20 some years ago, and that was never the intention, that this was to go on more than 2 or 3 years. And so I know all 3 of our local counties are doing it. Oh, some aren't, but ours are.
Yeah, I mean, I can certainly ask more questions. I
Yeah.
did not know the history
Yeah.
of it, so, I can certainly
Yeah.
ask some more questions.
Yeah.
And we'll check
Thank
locally.
goodness
'cause-
you're here
I
with
know.
your historical knowledge on this stuff.
But to check, yeah, locally that
Yeah.
nothing was done.
I
And
didn't
Mark,
know
I don't
that-
know if you
that
have
existed.
any, Mark, I don't know that you have any history on if anything would have been
Not from
passed.
22
locally.
years ago.
No.
Well, or just like locally, did we pass, anything over the years?
I think they
No,
just
not really.
looked at the law, and yeah, because I don't remember anything back from when I was just getting out when all that happened. What is there, in the county, maybe 2 left?
No,
The Jamestown
there's a handful.
Oh, okay.
There's a few of them are like the bars, like the
Yeah,
club
the
bar
inn.
kind
Yeah,
of thing.
yeah.
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 So they get a waiver.
They get a
To
waiver.
allow-
Allow smoking?
They
Yeah.
get a waiver
They
and then-
pay this for
Yeah.
it every year?
Yeah.
Is that what it is?
Yeah.
Correct. And there's requirements. It's not supposed to just
I
be,
didn't even know it existed.
Yeah.
there's supposed to be a room and ventilation and, and we do inspect them.
Yeah.
Um.
You come out smelling like.
These are the hazards.
Yeah.
Do we go to change that?
How about we triple that fee?
Yeah. Well, and I mean, that's another option. If we have the ability to make it $1,000 a year, it might make a difference. And it would be maybe less political fallout than totally eliminating it. Yeah.
After 22 years, maybe it's time, maybe give
Yeah,
it 3 years notice that it's
yeah.
gonna phase out.
Well, and that was the original intention.
Yeah,
was
so
like
I
3
think
years.
it's
Then we'll be here.
probably time.
Yeah,
I know, yeah.
yeah,
We never even raised the fee.
yeah, yeah.
Oh, it's okay if you make money on it.
Yeah, right. And yeah, yeah, people,
Exactly, exactly.
yeah. Yeah, there's a lot of that,
Yeah.
but just worth checking
Yeah.
it too.
So, yeah, I can certainly look into that, and get some maybe feedback from the state too.
Yeah.
Well, yeah, what their thoughts are on this, but as far as the fees go, ball's in your court.
So
I mean,
we could increase the fee in this.
Yeah,
Appendix if we wanted to until there's more clarity
Right.
about what the future of this will be.
I'd like to see if you can get more clarity first,
Yeah.
then have maybe discussion at the next meeting or something about it. See what you might be able to find. So a bias wouldn't be to increase the fee, it would be to, for the time we phase out.
Yeah.
And
You know-
maybe it's not 2 or 3 years. Maybe it's-
And who knows what the state bureaucracy has done with this, you know, they may have kind of changed intention over the years, you know, you just
Yeah.
don't know, but.
We can still vote on this and then revisit that.
Right,
because it's an
right.
Oh, yeah,
appendix, right?
because this is what it is, it's not, yeah.
All right, well, I will get some more information.
So do we need to vote on, it's just all of,
The package,
so Article 1 first, then the appendices?
I mean,
Or is
I,
it one appendix?
Or the Article 1 as
Yeah.
written plus the.
It's all one
right,
appendix,
it just, I tried to make it just this whole big chunk.
Yeah.
Plus the appendix is included in that chunk.
Yes, and it's one appendix. Jessica and I have talked about that as well, you know. Instead of, you could break it down into multiple appendices, but Jessica had said, you know, basically the idea would be like every 3 years you're revisiting this.
Yeah.
No matter what.
Mhm.
And that sort of follows the lead rental registry timeline of things. too.
yeah, then you're not doing it a piece at a time. You just
Right.
look at it.
That was my idea, is try to keep it clean.
Can I get a motion to approve the Article 1 with the suggestions as written in green, along with the Appendix 1?
So move.
Second,
Dr. Pender?
Nice
Okay.
job, Jessica.
Thank you.
yeah, it's all,
Thank you for your support. That I can bring you guys something to vote on.
So that was
Good,
all
yeah.
sub-points 1, 2, and 3, is that right?
Yeah, that
Okay.
was my everything.
Did we vote?
No.
Not yet.
Oh, I'm
We're
sorry.
having a discussion. so-
Yeah.
Oh.
Yeah.
Good comment.
All in favor of the motion?
Aye.
Any opposed? Okay. Now we're good. Okay.
Thank you, folks.
All right. Lacey.
Okay, so thank you. Happy Thanksgiving. Wonderful to have you all here, as always. Yes, a major thank you to Jessica and her team who all pour into this. They are a very well-informed bunch, as you can tell. They really know their numbers, their, their regulatory business, and it makes this go very smoothly. So I certainly appreciate that as well. So just wanted to start that off. I think Anna just left, but this was also part of Anna's birthday. So I had wanted.
She likes you guys, but.
I had told her we were gonna sing her happy birthday on her birthday, so I think she really.
another
Yeah.
reason to leave.
Sherry Rader said she was gonna be watching just to hear that, but so we won't do that, but Sherry,
As a waiver.
Right.
Before we limit it.
for the record, a very happy birthday to Anna and a couple of the first topics too. Are right up her alley, but also just did want to make note that Steve Kilburn is with us tonight. So for those of you, you have all, I'm sure, met Steve, and he's been to Board of Health meetings before, but he is officially a county employee with us in the health department as our planner, and working on planning and policy. And there's some other staff that work with him on the grants and funding side of things. So that's sort of part of the larger strategic plan for the department, that we are really stabilizing the infrastructure of the department to ensure a nicely diversified funding stream and very balanced department in terms of staffing and leadership. So welcome, Steve. I'm excited to have him with us. So just a couple of quick highlights, because I want to ensure that I give Dr. Pender some time at the end of the meeting here of some other wonderful updates and get us out before 8 o'clock for the Bills game. Go Bills. Also for the record. So the LED Smart Education Conference was held on October 8th. So Ken had just talked about that as well. Some really neat highlights for that. I did want to make note that County Executive Wendell did attend that day, and he actually stayed the entire conference.
Yeah, he
He's the
did.
first county executive of any of the 3 counties that participate to come and really show his support. The legislator, particularly Chairman Pierre Chagnon, has been overwhelmingly supportive of the lead work, that lead prevention. Lead poisoning prevention. I really need to be specific about my words here.
Yeah.
In our county. And it's just a really wonderful kind of peak that we've hit here. And it's really going to be for, as much as it can be in government and bureaucracy, a smooth sailing from here, is what I'd say. So we certainly appreciate their support. I was hoping that Dr. Khan would be here because I also wanted to highlight Southern Tier Pediatrics. The Jamestown office was awarded the Provider Excellence Award at that conference, as well as some other great award recipients as well, like JCLC that we work with really closely, and some other programming that we do, and then NECO Construction as well. So it's a really great partnership between the counties that really are streamlining all of this work to ensure that it's not just prevention work that's happening in one county, but across New York State. Also wanted to draw your attention to the National Association of Local Boards of Health. So we were able to secure a free membership for a year for that. I'm sure you were all just like very excited about that. So how this will work is I'll actually be given access to like the portal and the membership, and there's different trainings, there's different model policies, different emerging issue type things that the association will basically push out to me, and I will be sure to pass those things along to you. There is a conference every year and some great like newslettery type information that they pass along. So you can be looking for that. I'm going to kind of scour through it, and you and I can talk to Dr. Kidder too about we might be able to get others access into the system. But I just thought it was a nice support, especially as we are looking at like our sanitary code and with the lead rental registry coming down, and some other great opportunities that Steve is working on in policy that we're going to bring to you in 2026. So it's just a great time, I thought, to have that available to us. Before I head to public water systems, because I'll have Jessica speak a little bit on that too. Did want to make you all aware that we are planning to do some legislative outreach days in 2026. So this will be really a process of inviting the new legislators who have just been elected to come and be with us in the department. And it would be open to existing members as well too, so that they can really, in a more immersive type way, learn about what we do in the department, what our state and federal regulations, what our public health law is, what mandated services we are required to provide, and what sort of dictates the work that we do on a daily basis, so that when we go before them with resolutions or, potential local laws that we would, like them to pass, that they would have already a really great basis of understanding. All of the human services departments are very much alike in that we all have a preemptive authority at the state or the federal level, but all completely different in what we are mandated to do and why we're mandated to do it, and how we're funded in what ways. And that can be an overwhelming experience for an elected official, especially a brand new one. So we just want to make ourselves very accessible and transparent to them. And also just so that they understand they can come to us with questions, and clarifications that they may need. So as we plan those, we will make you all aware too, so that if you would like to come, on those days or be available, we would certainly love you to be a part of those as well. A few updates: the community health assessment and the improvement plan. So you've heard me talk about this a couple of times, and if you've been with the Board of Health long enough, you've probably heard about this other years. The state has changed the way that system is, the way that they're employing the CHA and CHIP for the better. I've sort of been a critic over the years of the state's CHA and CHIP process. I'm sure the hospitals probably feel the same way in some shape or form. But it will be a much more dynamic and usable and interactive document now moving forward. And what it does is it provides our community partners, collaborators, healthcare partners, a snapshot as to what is really happening in our county. So it's really easy as a service provider, I know you all know in the different realms that you come from, to be very aware of maybe what is affecting the population that you serve, but that obviously is not necessarily indicative of what's happening countywide on a more community or public health level. So this document sums all of that up and is meant to be a working document for our nonprofits and for partner providers to help drive their strategic planning and their decision-making in the 3 to 5 years ahead. This has been a really successful process this year. We've been really grateful for the participation that we've had from all of the major medical providers and hospitals, as well as our nonprofit organizations and our other community or our other county agencies as well. And we were afforded a really wonderful compliment that, you know, I have to pass the credit on to Sherry Rader and Steve Kilburn for this, but a consultant that works with the Healthy Community Alliance that works sort of regionally throughout New York State gave our team a very wonderful compliment in terms of how successfully they have navigated this process and the product that they have created. And she sees lots of different counties' improvement plans in Chautauqua. So that was a really great compliment that we were afforded. I wanted to pass that along. I will leave off, well, I'll jump next to strategic planning because dental services and water systems are a nice transition to the ladies here. So our strategic planning process, so again, I'm really thankful to have Steve with us because he'll sort of help spearhead a lot of this moving forward. But we are down to just really 2 positions that are open in the HR process right now. Those technically really aren't even vacancies. One is a change position based on a retirement that we had, and that new position is going to fit much better for the needs of what the division needs in our community health section of the department. And the other is just kind of rounding out that planning and policy group that we're looking for. So we are in really great shape from a staffing standpoint, which has been wonderful. We're very thankful for that. Again, I always have to give the shout out to the division leaders, Kathy, Wendy, Denise, Jessica, Sherry, Steve now. It's a culture that they're creating that people want to be a part of and are staying with. So I always appreciate their work in that realm of things. Some staff development and training goals that we're meeting. We were able to secure for free. It's really like, you know, $3,000 per person. The Public Health Essentials Training course through Cornell University. And this helps people who are coming in or have been in the public health world, but maybe have never received specifically, you know, higher level public health training. So a lot of times historically, we saw this as health departments were formed, you know, 60, 70, and 100 years ago. It was really to meet the needs of provider gaps in a community. And as the role of the health department has changed over those years, you know, we brought in a lot of nurses in particular who were not trained in public health per se, but were providing public health services. So these training programs were built up really to train those types of professionals. On the environmental side too, we have a number of people who come through an environmental science background and then blossom into the public health world. So these training courses are really built to, you know, give them a really substantial sort of understanding and feel really confident in the language and the systems of public health. So we have 4 people that will be going through that course starting in December. So we're really excited about that. So jumping back up to the public water systems, I did want to make note too, again, the sort of just exemplary staff that we have in our department. Of note, our water division. I know I've talked with you all about them a lot, and Jessica has too. They navigated a pretty serious drought situation that I'm sure you are all aware of through the news. There was a lot of reporting on it. But Natalie, Casey, Ron, there's others in that department that I'm going to forget, but they're sort of the leaders. Just did a really excellent job in sort of navigating that situation, working with the municipalities to stave off, you know, what could have been really terribly serious effects of that drought situation. So anything you want to sort of add to that? And,
Well, I was just gonna give, I'm assuming that you heard about the Ripley situation and the efforts. I mean, it was very impressive, honestly, you know, they were trucking in over 100,000 gallons of water per day, to replenish that reservoir before we got some substantial rains. And, you know, the conservation order was issued for Ripley. There was also a conservation order issued for Fredonia. Both of those communities are on reservoirs. The other reservoir community is Westfield. Westfield never did go on a conservation order, but we were definitely chatting with them frequently, to make sure that we didn't get to a point where we needed to, you know, to sort of go that next step. But yeah, the effort with Ripley, and especially, you know, Ripley, we were bringing in water from across state lines. You know, Pennsylvania and Northeast Pennsylvania was providing the water to assist with that. So it was just a really great collaboration. Natalie is amazing, and I am happy and not happy that it happened this summer, because it certainly provided a learning opportunity for myself and some of the other newer staff, so that, you know, when this happens again in the future, because it's the thing with these reservoirs, they're very subject to drought conditions. You know, when this happens again in the future, we have a clear understanding of what works and how to handle it. So,
yeah, and there is probably not enough recognition for the technical expertise and all of the planning and communication it takes. Just moving water, from one area to another is a feat in many ways. There's just a lot of regulation, very meaningful and very necessary regulation around all of these types of endeavors. So again, Natalie's sort of expertise in navigating that, having the trust and her counterparts having so much faith in her, it really does make those situations much easier for us to navigate as well at the county level. But there really is a lot that goes into that, and I'm sure the county or the community, the wider community, doesn't really know all of what happens there.
I didn't realize it till we got our report for the town of Carroll, and I realized, oh, yeah.
yeah, because
And so we're next month going to commit to the first $15 million of improvements. We got a $5 million grant and 10 million in zero interest loans. So
Yes.
we're going to go ahead and that's only the first half.
Yeah.
It's going to cost us $30-40 million to get where we need to go. But
Well, and that's I wear a lot of gold, but I talk a lot about silver linings. So the silver lining
Yeah.
is sort of these exact conversations. And I know Mike and I had Dr. Falk and I had a number of conversations with the county executive about this as well, and just the level of awareness that it brings.
Yeah.
So oftentimes, in our small municipalities and rural communities, we're trying to pinch every penny that we can.
Yeah.
And that can lead us to some pretty difficult times
Yeah.
if we do that. So just the willingness of other municipalities to, again, trust the message and trust, what we're providing in terms of education in the communities, that this is reputable information, and taking that and making some really thoughtful
Yeah.
infrastructure moves.
I mean, we've talked about it for 10 years,
Yeah.
but it took that
Yes.
report coming into the hands of all of us lawmakers saying, we gotta move. We can't just keep talking about it.
Yeah.
so
So
you're
yes.
certainly not the only community.
Yeah.
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 Yeah, so if there is
Oh,
a
this is
silver
Fredonia.
lining to those things, it is that. And a major thank you to the Ripley officials as well.
Mhm.
Jessica and Natalie have told me just, they were wonderful to work with, very receptive, very responsive. So again, it's important to hear the very good things that happen in the community as well, because there are. With that also being said, in the vein of water and public water systems, there had been questions raised at previous meetings about fluoridation. So we just wanted to sort of brief you on some of that information. There have been questions that have come to the health department, of course, because, nationally this has become a reinvigorated topic. And so we, reached out to a number of different channels and state and national agencies and associations that we work with. And Jessica was able to provide a couple of, like a fact sheet as well in regards to what fluoridation looks like in our county. So I'll let her talk a little bit more about that as well in a second. But overall, in regards to like what the public health message is around fluoridation, is that really nothing has changed in the science over 30, 40 years in specifically fluoridating water. Where I think most of the questions and concerns come from is that there are, of course, a number of different modes of, operation in regards to fluoridation. So there's fluoridated toothpaste and there's or sealants and varnishes that can be put on, and then there's fluoride in the water. Those concentrations are all very different and they're all based in science. So of course, the level of fluoride in one of them is not going to be equivalent to the level of fluoride that you might find in your water system. So overwhelmingly, the evidence over the last 30, 40 years is that fluoridated water systems only actually have a benefit for the public in regards to a drastically reduced dental caries, in the population. So reducing cavities in the population, which has a much more significant effect if you do not prevent dental caries, of course, on heart health, in the full gamut of overall health and wellness. So at the state level, regionally, the message is still very much supportive of, public fluoridation of the, public water systems. It is a unique conversation here in our county because the majority of our land mass is actually septic, not really on public water systems, and not every public water system in Chautauqua County fluoridates. So Jessica can talk a little bit more about that, but just wanted to provide that information to you. It is a discussion that is happening statewide, nationally as well. But even within our regional public health groups, we're all talking about this, about, sort of what every community is doing. And again, uniquely, it's a nice transition eventually into Dr. Pender talking to us about dental health, because it is one of the most significant and successful public health interventions that we do have related to oral health. My other little plug that we were talking about earlier is, I would certainly love it to be an issue that people are, drinking too much water. That's typically from a public health and nutrition standpoint. We know that people aren't drinking enough water at all. So, in that sense, people may not be interacting with fluoridated water, much because they're substituting other sugary drinks instead. So we certainly hope that people continue to drink water, and the intervention message is fluoridation in the water system is safe, especially at the concentrations that is allowed in the water system. So Jessica, if you would just highlight a couple of the points locally in regards to fluoridated water system.
So I can start with just the communities that do receive fluoride in their drinking water. So Jamestown BPU does fluoridate their water, as does Westfield. The other communities where fluoride is in the water are Silver Creek and two of the town of Hanover districts. And that's because they receive their water from the Erie County Water Authority. So that fluoride is being added in the Erie County facilities. But everybody else, no fluoride. So it's interesting. I live in the city of Jamestown area, and there are a lot of people who talk to me about, fluoride in our water, and I remind them they don't have it. City of Dunkirk. I'm sorry.
You live in Dunkirk,
Yeah.
Jessica.
Sorry. Jamestown's in the top of my.
I know you saw
Sorry.
it there.
Yes. So it's one of those, misconceptions, and people start hearing these things in, the media, and they start forming opinions without necessarily having the information. So, the information for Chautauqua County is by and large, people are not consuming fluoride in their water.
But just so, because I didn't know about Erie County, so the Erie County Water Authority is all fluoridated.
Well,
So,
there was a little snafu with that where they were
Oh, for a little bit they weren't or something.
Yeah.
They get
Well, yeah,
something
that is
close.
what their protocol is
Yeah.
supposed
Yeah.
to be.
Supposed to be.
It was supposed to be.
So
Yeah.
to that, so there is regulation in public health law around fluoridating in your water system to both fluoridate or to discontinue fluoridation. It is regulated through public health law. So yeah, municipalities or authorities, can't just stop.
Shouldn't,
Okay.
shouldn't.
Yeah,
just
yeah,
stop.
yeah, they shouldn't just stop.
I guess I just wonder if there's any way we can use that. And I realize this stuff gets so political or whatever, personal opinions, but talking to Dunkirk, or in this case, the North Chautauqua Water District as an example. Maybe using Erie County Water Authority as an example. So, well, I mean, it's a big issue. It's just, I don't understand why. it's
So
so
each
difficult.
municipality gets to
Decide.
decide, and,
Well,
and there's
each
nothing in
public
our.
Depends where they get the water from.
Each
Yeah,
public
each
water.
public water
system.
system.
Has anyone championed that effort in history in our county to try to convince these municipalities that don't? Has there been any?
I
Is there anyone else?
wouldn't, not that I am aware of, because it really is such a municipal, I mean, it really has to start at the municipal level. We can certainly talk to them. And there are grants. New York State offers grants if you would like to add fluoride to the water treatment process. There are grants available to help communities do that. But no, as far as I know, nobody has really.
Would it help to just even send an information sheet on fluoride to the municipalities? I mean, I'm sure our water guy never thought of it.
I mean, we bring it up with the water operators.
well,
Whether
yeah.
the water operators
Yeah.
translate that information to
Right,
their
to the
board.
boards, yeah, if
is
it could
the
get to the
different-
boards, yeah.
Yeah,
'Cause, I mean, we had a major ordeal when we had to start adding chlorine. I mean, I'm still hearing about that 10 years later.
mhm. Yeah, I'm sure, yeah.
And it doesn't need to be voted on, right? Like the municipality can decide and start doing it, right? They don't have to have a
There
vote
is
from the
a-
public.
No, not
No,
the
it doesn't take a
public,
public vote, but yeah, a board vote or a,
And
yeah.
it does have to be, the information has to be accessible and open to the public, so that basically they can comment.
Well, yeah, we'd have to have a public hearing.
Yes.
Yeah.
Mhm.
Well, I would think coupled with the grant information, that would help too.
Yeah.
It's like, how are we gonna pay for this?
And statistics on early childhood caries in our county
Yeah.
package.
Yes.
I will go
yeah,
to every town.
Yes,
in
and
their
that
meeting.
is, so the state health department does keep, local level dental caries information, so that is part of the work that Steve, is working on right now too, with the sort of larger dental access issue, is, having them send us nicely packaged information, because I think it would be a really nice, demonstration of where there are lower rates of dental caries in the
Right.
community and where there are higher.
Does the chart show it? I mean, I'm all for it, but it would be interesting just to see, okay, we got Jamestown, Westfield, whatever. And what are the
Yes.
dental caries there compared to, like, people say, well, it's their population. I mean, you can always find an excuse, but if it's significantly different,
Yeah, no,
you're
there's,
dealing with facts.
that's what, exactly, and that's what,
It's 2.5, I mean, countywide, 2.5 times higher than the state average for 5-year-olds.
I guess we take a lot of them are wells, which is,
Yeah.
an issue there too.
Yeah.
But, yeah, I mean, something like that, then going to, timing is good too. We had the election, some places have changed over trustees or mayors or whatever. Be worth an effort if we had,
Yeah,
bar chart.
just sending a nice information chart with that kind of
Dr. Pender
information.
can go talk to
Yeah.
Yeah,
their.
Yeah, and then
I
we'll
go to
invite
every
you.
Mayville
We'll
Village
invite
meeting.
you.
I will
Yeah.
be there. Bring it up.
Yeah.
Yeah, I mean, our county has such a need for dental health providers, but this is a way to like help even just reduce the need for a
Yes,
provider because the
preventative.
kids don't have cavities. That's.
What is it in Mayville? It's all coming out of wells, isn't it?
Mm-mm.
No?
Yes.
Yeah,
But they can fluoridate that municipal well, right?
they
they-
can add fluoride to the treatment process. Yeah, I mean, so what would have to happen is if a new community decided they wanted to add fluoride, they'd have to bring in a professional engineer to look at the plant, to look at, the treatment standards. And then those plans would go through us and through the state to make sure that they are doing it in a safe manner. They'd have to have, safe storage for the chemical. They'd have to have safe handling protocols for the staff handling, the chemicals. And then there would be, it would be added, and then there would be sort of a more intense, sampling protocol once the addition started, just to make sure that all the water chemistry is staying cool, and, lines aren't being leached or affected differently. And then, yeah, that's what it would look like. And conversely too, if a community decided they didn't want to fluoride anymore, the correct way to do that would also be get an engineer in there, take a look at things, look at the chemistry, make a plan, run it through us before it gets
So
implemented.
right now, just be starting the engineering. We'll approve that next month. So I should I should ask that that's a part of the evaluation. So
Yes.
that we can present that option to the board.
Yeah.
Okay, we'll do that.
Yeah, and with the discontinuation, there's also supposed to be the public notice as well.
Mhm.
There's supposed to be like 90-day wait periods and the whole nine yards, so. yeah.
Are the non-fluoridated communities, were they fluoridated and they have voted not to fluoridate, or is this all just long-standing history of?
As far as I am aware,
We never
they have not been fluoridated. And it's just the Westfield and, Jamestown BPU that have chosen to. And then, Silver Creek in town of Hanover, when they had to consider where they were going to get water from, Erie County Water Authority made the most sense, and the fluoride was already there, so they wouldn't have had a say in that.
How many municipalities have their own municipal water system in our county?
There's a whole chart over here.
Well, because there's municipalities and then there's districts.
Right,
so-
yeah,
So like the town of Pomfret is one municipality, but they have different districts.
right, yeah.
So, but yeah, I mean, Jamestown, Cassadaga, CUD, town of Chautauqua, Clymer, Dunkirk, Fredonia, Mayville, Brockton, Portland, Pomfret, Sheridan, town of Dunkirk, that's all North Chautauqua County Water District. Pomfret, there's 4 districts in Pomfret, Ripley, Sherman, Silver Creek, town of Hanover from Erie County. And then there is a town of Hanover.
So those are coming from Erie
Forestville.
County, yeah.
Yeah. And then, Sinclairville, Carroll, Frewsburg, and Cherry Creek.
Yeah.
So, yeah, they're all speckled.
Looks like we have a new advocacy issue to plug away at.
Yeah, we can certainly, and I mean, you could always sign a letter as the Board of Health
Mhm.
to go along, with, outreach, to the.
With that nice visual with the charts.
Yeah, and we're
Yeah.
excited to see that. And so we can, certainly come back and present that information to you in 2026. We'll add that to the dental strategic plan that we have going. Because I think that, that was sort of our intention, was to look at and see, hey, this is pretty standard research methods and statistics that we could do, is just looking at what Cary's, rates look like in the public water system areas.
But it is such a hot button issue nationally. I mean, at least what I've read, it's so anecdotal, but more dropping out than adding it. It just seems to be there are areas that are, it's gonna cause cancer. God knows what people believe, but, or say, but at any rate, I don't know. I enthusiastically support the effort. I think it'd be a bigger lift than perhaps we might think, but it doesn't mean we should try. And we got an obligation, in fact, I would argue.
It depends on what voices are speaking right now,
Yeah.
and that can change, hopefully.
Well, we have a powerful voice as the
Yeah.
Board of Health
Yeah.
to weigh in with some recommendations, so.
And if we went to these meetings, then I'm very much willing to go. And I think other dentists would too.
Well, as I said, this is sort of a perfect transition into talking about dental services, because really, so again, I've been updating you all about this, and again, just a reminder that the health department per se, really does not have mandated or regulatory space in the dental world. But clearly it is a public health and community health level thing in our area. So as part of that larger planning effort around, if I can sum it up quickly, access for our community, workforce development and availability, and then other public health level interventions like fluoridated water systems and things like that, and the policy and the policy work that goes along with all of that is sort of the three-headed, trifecta planning space that we're in right now as more of the technical advisors or technical assistants, not in the content area by any means, because our providers are in the content area, but more so in that sort of socio-ecological approach to this issue. And so with that said, we just talked about a couple of the things that we're working on in the area of policy development, sort of fluoridation discussions and advocacy, that type of work. But before Dr. Pender talks about sort of that workforce development piece, I did just want to give you an update as well on the actual access piece of things as well. So of course, the UB dental van no longer here. So we've been working with the providers, with CHN, with TCC in discussions about what does this look like? Who has capacity that could come in and do this work? There is interest on behalf of funders and on behalf of the larger community to see access improve in our county. And it is needed based on a lot of the metrics that we have available to us. So we just actually had a call today with TCC rounding out sort of what their capacities may look like in the future. And coupled with that, Fidelis has sort of moved into this space as well, which is a new area for them, literally doing mobile dental work. And they have started some pop-up clinics throughout the county. It's not always, believe it or not, an insurance provider's first thought is to reach out to the local health department, but we invited ourselves into their mix. Steve did that.
Welcome.
We were very welcome. They were very receptive. Steve is great with public relations around these types of things. So he handled, those conversations really nicely. And moving forward, we are going to be working with Fidelis to help them plan where they will be doing their pop-up clinics and to help inform their decision-making to ensure they're really reaching the areas and populations and target populations that we know have the least access because of a number of different variables. And at the same time, working with TCC to see what we can do there for them to fill in sort of the other gaps around that. So that planning is coming together really nicely. The Board of Superintendents for the schools has been continually informed along the way. The superintendents have been very excited to hear that this work will continue in some way, shape, or form, and have pledged their flexibility and their support as well as we move forward. So there are some really exciting things happening. Steve and I were just talking today that you honestly couldn't hope for a better scenario where all of the stakeholders who should be in the mix are excited to be in the mix.
Willingly.
Willing, yeah, not only just willing, they're excited. So it's a really wonderful thing. So again, just thank you to Steve and glad to have him on to really be able to spearhead just sort of the facilitating of these groups and bringing it together.
How does Fidelis staff these pop-up clinics?
So it's actually subcontracted.
How does Fidelis staff these pop-up clinics?
So they contract
Yes.
with dental firm. I mean, you're probably more familiar with these that are, I think, exclusively maybe mobile units. I don't remember the name of the one that they sold to me, but it's based in Connecticut. They have units probably around the east. And so anyway, they contract with them, apparently in these cases for like a couple of weekends, if you will, to come into a community. And I think they brought just one provider and like an admin or receptionist person. Then Fidelis shows up too, and they've got whatever they want. Oh, at the same site.
It's kind of like a locum
Yeah,
tenens position. I mean, it's very highly paid.
Yeah.
It's very lucrative for the providers.
Okay.
Well, how
What's the
Is it a
volume
paid
that-
service or is it a free
So this
clinic
was
or
exclusively for their
Those
Fidelis coverage,
patients? Okay.
public, of which, I mean, I don't know the number, but as I said, they could come every weekend. They could come
Yeah.
every day. probably,
Yeah, they
and
could
not
come,
exhaust their clientele. So, I mean, you know, they can only see, of course, so many when they're only here for a couple of days, but we're really hoping to encourage them. And not only encourage them to keep coming back, but Lacey said, kind of more strategically go places where we can put them where TCC can't, or the point, people can't get to TCC.
How does the public know about these clinics?
Yeah, well,
That's
I
one of,
really-
yeah.
yeah,
that's one
I
of the
mean, like,
things we were talking about.
they put up, I mean, very informal. Well, I shouldn't say that. There was maybe social media.
Yeah, there's some
But I
social
mean,
media.
it-
that run
It
Immediately.
feels like this. And then you're calling.
Right. So, and that's where we were hearing from the schools that like, oh yeah, we would love to do it. And then they would go and they'd be like, oh, it's already
Cool.
full, like 30 seconds later. So that's where the discussions were received, was to say, you know, could we carve some of this specifically out for a specific population? The aging population is the other. That, you know, major difficulty in access. There, you know, that's a population that would be difficult for us to even get them to a location at TCC. So could we bring something to them? And then reserve TCC's capacity for people who may have some more mobility, maybe not their own transportation, but could at least utilize CHQ transit to get there. So there's some neat planning happening. Yeah.
Just to run that up, Heritage, as I may understand it, actually does, they have a contracted provider that, because they're a lot, right?
Yeah,
The
here
challenge
at
really, and I think the nursing facility, like daily care. It's a challenge, right? They probably pay quite a bit to contract some. That's not a challenge. I think they're figuring that out. It's getting oral care among the skilled nursing residents. But there again, we're looking at
Yeah.
some funding things.
And what's interesting about when we talk about the aging population, so you have your skilled nursing population, who probably has some more access in a lot of ways than even the homebound independent living older adults. And so those are the ones that could really benefit from a pop-up, you know, at their local church parking lot or something that they could get to more easily. So some really, again, wonderful things coming forward, daunting in a lot of ways, but so glad to have the support of the people in our department to do this great work and partners in the community, which it does not work unless we have the partners in the community to actually do all the frontline work. So with that, before I turn it over to Dr. Pender, just a very sincere thank you to all of you for your participation on this board. I sincerely have been very motivated and inspired by your willingness to come and not just, you know, review things and sign things, but very actively engaged in the discussions and planning around the health of our community. And so that makes my job so much easier and so much nicer to know that there's a vested group of people that don't have to be here. You aren't getting paid a salary to be here, but you show up anyway with great ideas and your expertise. And I am truly grateful for that. So in the season of Thanksgiving, thank you for being here and being a continued part of this. And with that, I will turn it over to Dr. Pender to talk more. So you can talk anything you want about the dental stuff happening because you are so involved, a true champion in our community. But really a great effort with the Dental Connect program that we're very excited about.
Yes, thank you. I'm gonna focus just on the Dental Connect program because I could talk for like days on all the other like different areas. But because I am a private practitioner, I own my own business, and I really enjoy being in the chair with patients. It takes a lot of my time. So sometimes all of these efforts and passions, I just don't have enough time to do things. But this Dental Connect program came about kind of funny because a lot of us practitioners get approached by people who want to come shadow. And I'm always like, yes, come shadow. This is great. But then like sometimes I'm sitting in the chair working on the patient and I have these students who are just like standing there doing nothing. And I'm like, this is really, you're trying to engage them, but I'm also like focusing on the patient. And it becomes awkward. And I'm like, I feel like they're getting nothing out of it, but I just can't take the time to like walk them through because it's going to just take forever with the patient. So I voiced my frustration to my practice manager and was like, we need to do something about these shadowing students. We need to make a program that's a little bit more engaging so that whether they're here for one day or a week, they actually get something, they leave our office and they can make a decision on, I'm gonna go into this field or I'm not. So we started what's called the Dental Connect program, and it can be a student, it can be any person who might be interested in the field of dentistry. And we've created this just intro program where you can come, you can learn basic terms, you learn different, just very, very basic things about the dental field, whether it's dental assisting, dental hygiene, an actual dentist, dental laboratory technician, and all the specialties. We put together a binder, and it was basically a little track for these students to come in, and they go through on a little schedule, whatever time that they have. It can be 1 hour a week. We had a student who finished all of her high school requirements at Chautauqua Lake early, so she would come twice a week. They did a work release with us, so she would come to us, and we had this binder that she would go through each day. Today, you're going to focus on what a sealant is. We want you by the end of today to know all the steps in a sealant, and it's in this binder. And it was just for me to like know that this person was doing something while they were in my office without me having to like walk them through it. And I was talking with Jim Sherry with Chautauqua Health Network about this just at a social gathering, and he's like, I really like this. This is like a huge workforce development piece because we are just so dire in public and private sector. Our future is just so bleak in the dental field. So this is a way that we can get a pipeline for all the different areas of dental. So he was able to give us some funding so that we were able to spend some time and create this and make it basically go throughout the county. So we met with other dental offices in the community and walked them through the binder, what it looks like in our office. My practice manager, she meets with someone at each office, whoever's going to facilitate the program, talks with them, tells them how we do it. And then any person that might be interested emails, her name's Annie, she works in my office, just emails her, and then she talks with them, finds out what is your availability? What are your specific interests? And then she just matches them with an office in the community that they can go in and do this shadowing opportunity. And it can be for a day, it can be for a few weeks. And the Chautauqua Health Network has some funding too that they've been able to give some of these students as a scholarship when they complete. There's a basic and there's an advanced track. So they give them at the end when they complete it a scholarship so they can use it towards hopefully going into the dental field. But it's to make people make a decision on this is for me, this is not for me. And most of them, we had 6 students go through it already, which is awesome. And not just in my office. I was worried that like this was going to happen and then they were all going to be in my office. But it's been great, and it's just really getting its feet right now. So yeah, it's a way to try to just get ahead of this problem. And I don't know, it's such a good field to work in. It's like the best work-life balance. I mean, I also like, I'm very busy, but I put that on myself. Like, you don't have to be as busy as me. But it's just such an awesome career to do whatever you want. You can be a parent and work and just make a great living. It's just so good, and people forget about it a lot. So we want to make sure people are aware this is a choice. And we're also working with JCC to try to get a pipeline of a pre-dental hygienist track. All sorts of things have come out of this. But if you guys know anybody who might be interested, reach out to me because we will get them rolling to see if the dental field is right for them. And that way we have providers in the future and not having hopefully this continuous issue, you guys know it's impossible to get people to work in our field right now.
Even at the
All the
dental
school-
school, they're not getting enough patients for the
Right.
students, you know?
Mhm.
Do the
It's,
school counselors know about
We
programs?
talked, yeah.
Yeah. So Annie actually, right in the very beginning, there was a school counselor webinar. And we didn't even have like our whole program set yet, but she was able to Zoom in, and I went in and we gave the initial, here's what our program is. And then now we've reached out to all of them. And then the Chautauqua Health Network has helped us make some actual flyers and like rec cards to put on so the schools can have them, so they can,
Great.
yeah, get these students connected.
Okay, commend you. That's wonderful.
Thanks. Well, it's really my practice manager has been, it's like been her
Annie-
passion.
Annie is great, and she's been really good about, you had alluded to, so much more has come out of it.
And so I
Mhm.
think you both probably weren't like, oh, all of this is going to, now all of this is on our radar now that we have to participate in too.
But it's been really neat for us to be a part of, because typically, especially in the dental world, historically, dental is not like ubiquitously, in the system of public health. And so it's been really neat to be able to so seamlessly build that in with the larger system and framework within our community. And so, again, it's something that we wouldn't typically do. We're not mandated to do from the state level, but it's just made so much sense for us to get to be a part of this and help amplify across the board, and it's inspiring some other things like Dr. Pender was talking about. And I'm hearing about it in other circles, which is so funny, like in other parts of the work that I do, and they're like, oh yeah, there's like this dental hygiene training program. Like, yes, I know about that. 'Cause that's a little, yeah. So it's been really neat to see it grow. And one of the things that I know Annie and I had talked about too was even just, having the providers in the mix who have the expertise to say, hey, what type of personality or proficiencies might you, have that would make you a really great fit for this? Where, the rest of us aren't going to know those things. But they're even able to talk to the school counselors about that. Like, hey, if you see a student, because even school counselors, they don't have all of that background and expertise and knowledge. So like, oh, if you have a student who you see is really proficient in these certain areas, they might be a really great fit. And this could be an area that you could encourage them in. So it's been neat to be sort of on the sidelines and get to watch it all.
Yeah, it's
Okay.
it's been great. I mean, I had one of my first students that came to me. She was just, she was an awesome academic. You could tell she was just a total go-getter. She approached us, I want to do this. So I sat down with her because she's like, I want to be an oral surgeon. I'm like, that's awesome. Here's what your future looks like. Just so you know, here's what it looks like. And she had no clue that you have to go to med school, you have to go to dental school. And I'm like, and you could totally do it. But you're in for the long haul. And she's like, all right. So then the first week she came and she shadowed me. And as soon as I took out the syringe, she was like, she walked up. And I was like, sir, this is going to get you surgery. That might not be.
But if you think back to when we were in high school, we had no idea what it took to get to certain careers. And so we actually had a group come through TCC and we had 10 different subspecialties talk to them. And one of the biggest pieces of information that was helpful to this age was, what is the pathway? Like if you do what I do, it's the 13 years. If you do what a social work does, you're looking at this. And how much school do you have to go through and how do you navigate it?
Yes.
So I think it helps.
It
with the
does.
pipeline.
I was in the last year of a master's program. It was a hybrid into a PhD program that I had a mentor say to me, now, if you ever want to have a family, and I was like, oh, I mean, that to that extent, it took me all of that time to be like, oh, this is what this looks like.
Yeah.
So these are great programs. And my oldest, Paisley, I was actually telling her, I was like, I think you'd be a great dental hygienist. Why don't you look at? And she's talked about wanting to be a pediatrician in the past. And she said to me the other night, we were talking about, she's like, I really wanted to, but I don't know about all of the medical side of it. And I was like, well, then that might not be.
She loves the kids and the making a difference. for her.
That
But we
medical
talked-
side.
She was like,
I
the
love
medical
kids,
part of
yeah.
it, though. I was like, yeah, that might not be a fit for you.
But just talking about that, that's really important to really have that arc of understanding of what things. will
And
look
what's
like.
out there? Like, I didn't even know what a PT assistant was. And now, I do, and we're
Yes.
learning about this, but these kids don't know what their options are until you show them.
Right. Yeah,
So.
you major in English and science
Yeah.
and we don't major in the profession a lot of times.
Aaron, are the schools across the dental disciplines, are they getting applicants? Are there just not enough slots or is it
Oh,
just
they're-
it's hard to get people to come back to?
It's hard to get people to come back.
Yeah.
Yeah, it's,
Growing aspect.
yeah, it is extremely competitive. They did close quite a number of dental schools, before I started school, but That was just due to the baby boomer demand, and then it was decreasing with the expense of running a dental school. But no, I mean, it's so competitive, but people just aren't wanting to come to rural areas. Which is, I mean, it's interesting. Dental school is so expensive that a lot of students graduate with no business knowledge, so they'll go right into a DSO. So Aspen Dental is really attractive when you have a huge loan. So that, the people jump right into that and don't think about coming the path of loan repayment or something like that. They want to just jump into their career and work for a big company.
I think a lot of young people thinking about the real benefits of military service too, when it comes to these specialties.
Yeah.
You know. And, government will help out a lot with those big schools.
Right. Yeah, same with the National Health Service Corps. That's what I did. It's basically free,
That's what I did.
free
too,
dental
yeah.
school. Yeah.
I've given several lectures on all the different loan repayment programs to try to tell them, don't let it scare you. You can
Yeah.
figure the money part out later.
Mhm.
Yeah. The
My,
other-
my high school had a medical careers club. And I wasn't part of it, but I got invited to shadow a pediatrician. And that made a big difference for me.
Yes, sure.
Senior.
There's medical explorers too. I've seen some of them. When I was at Brooks, we had them for a long time. And then a lot of kids that came, it was once a week and it was for like a whole year. They
Yeah.
saw everything. Shipped them through the lab and x-ray and everything.
Yeah.
And my dental student would love to come back here, but she's engaged to a pilot.
Oh.
And
I heard the Jamestown Airport.
yeah, I've heard that for the last 15 years. Yeah. Yeah, so they're looking at Atlanta.
Yeah. Well, to round it out in this portion of it too, I don't know if you had anything else to share.
No, I mean, I could, oh my God. I could keep going forever, but that's it.
One of the things that we did see in Dr. Falk, to, your question and your point too, that we clearly are seeing sort of in the historical trends too, is that we are sort of almost in this like dental school desert. I mean, we have UB there, but there's so many other communities then that spoke off of that, yeah, it's really, we're competing.
Yeah, we don't get them.
Yeah, we don't get them down here. So that's where that was part of the history with the UB dental van, was that they were coming down then. So it was exposure for our area as well, that the students were coming down and, seeing the area, and because there's, this is an attractive area in terms of cost of living and outdoor activity and things like that. So we are sort of losing that piece of it too. But there are so many of these other now wonderful opportunities springing up. And the part of the endeavor as well is the health department, we're going to help reconvene the dental advisory board. So you'll be hearing more about that coming in the early part of next year. So there will be some even, additional ideas and work done in that space to come out of that board. So
At least the RAM clinics now are bringing students down. And they're already working on the Olean one for next year. And so our 3 counties are rotating them now. So at least they're getting out of Buffalo.
Does Newcomb have a dental school?
So it's actually starts in their Fort Lauderdale campus. That's where they do a lot of their didactic courses.
Yeah.
And then they do some of the clinical training at like the Lee County Erie campus. Yeah. So I don't know the number of students they have and I'm not sure. They see patients there. But yeah, I'm not really actually connected with that program, but they do.
Does Penn State have dental? So we had a whole bunch of
I think
busload
Pitt
of students
does.
that came to the RAM clinic in Jamestown.
No, if Penn State does. I know Pitt does.
Yeah. The other big one for our area is Ohio State. That's a really, they have a dental and residency.
Case Western has a dental program there.
That's Virginia does too.
Because I mean, interestingly, and I bring this up in all of our meetings that we talk about, just from like our school district, I know of like 5 kids right now that are like recent grads that are like in dental school and like, come back here.
Mhm.
Some of them Welsh and Pepe, you know,
Yeah.
so it's
Yeah.
in the family.
Yeah.
Yeah.
They've got a reason to come back.
They have ways to come
I
in, but
think, Will Steed.
Wilstein,
He's
and then
over.
also Jenna Nacero.
Yeah, Jenna's,
Right.
yeah,
Then
Jen,
you'd be
Coco
yeah, she's my,
Campbell. Is it
Is she-
NYU?
she's not coming back.
Coco. I
Oh,
feel like I
she's
met
not-
somebody named
Oh, and then
Coco.
also
No.
Campbell Howard,
Because her.
actually, too.
Jeez,
Professor Howard.
Is gonna be a
I'm
pilot.
Right, yeah.
But I'm like,
Training for.
Yeah.
so
They have a
like
house
some
in
great work for the
Yeah.
advisory board to
Yeah.
like reach out.
They're looking.
Absolutely.
They have this information. I sit on scholarship committees for medical scholarships. And there's a lot of, you can see who's at
Yeah.
what school. So the, that community, the region, CRCF has all those names.
Huh.
So-
Good.
Yeah.
That's
Okay,
great.
shall we,
Yeah, thank you.
can I get a motion to adjourn?
So.
Okay, so one quick question, the dates,
Yes.
I don't fuss about typo, but it says 2026, so these are all sixes, not fives.
Okay.
I just want to make sure that I'm not trying to be fussy, I just made a copy of this year's dates. These are next year's dates. Once you make a six.
It's 26. and
Okay,
it's
all right, I just want to make sure there wasn't a
Yeah.
Those aren't
restriction.
Wednesdays.
And then my other question was, I've asked a couple times, and it was gonna be some follow-up sometime during this year with legal to see if we might be able to do Zoom for old retired guys like me who are in Florida, because, I can't make the first two meetings the next year if we can't do Zoom. But I think it sounded like that was probably a no, but I just, it was like, well, we'll check again, see this.
The last I was told, we can do Zoom, but you have to disclose your location.
If they want to come sit in my condo and I'm renting a
More
place
people might take you up on
There's
it.
gonna be one person.
for an hour, 2 hours, whatever it is.
All right, we did have a motion to
Yeah.
adjourn, is that right? Okay.
Yeah.
All right. Who made the motion to adjourn? Mark. Go Bills, happy Thanksgiving.
Also, real quick, mileage.
Sounds like Piper's doing okay.
Let's look out for that, you know, we're gonna try to get those signed and into ethics before, or into finance before Christmas season starts. So
Is it an electronic signature?
it's electronic signature or simply a verbal agreement that everything looks as it should be. Those will be coming through soon.
Lucy, thank you.
Yeah.
See you.
Yeah.